Hi, welcome back to Rebel Health. I'm Dr. Vora, a holistic psychiatrist based in New York City and currently in Auckland, New Zealand. And I just want to talk about a pretty serious topic, which is suicide. And I just want to put out there this idea that I think for the layperson or for someone who isn't personally associated with anybody with suicidal tendencies or hasn't personally known anybody who's committed suicide, I think there's this feeling that someone who would be suicidal is someone who's just very depressed and very despairing, and they get so depressed that then they want to actually end their life. And to be quite frank, in my practice, that has not been my experience. I find that people that are extremely depressed are still not necessarily any more likely to have suicidal thoughts than someone who's less depressed. But what I do find to be true is that people who are in the kind of ramp on and ramp off phase with psychiatric medications, they're the ones who have suicidal thoughts. And in worst case, they're the ones who actually have suicidal behaviors. So what I'm talking about is somebody who's just started a medication like an SSRI, or someone who is going off of a medication like an SSRI or a benzodiazepine, or even some of the atypical antipsychotics or the other antidepressants. It's in those vulnerable moments or phases that's when people start to have this uniquely dangerous combination of a kind of impulsivity and agitation coupled with a numbness and this kind of cloud that seems to come over the brain to create just total despair and hopelessness. There's even there's like this mixture of numb, impulsive discomfort, despair that I think is a really dangerous combination. And I see that over and over and over again, particularly in the withdrawal phase from these medications. And that's when I see people have suicidal thoughts. It has very little to do with when somebody has reached a real depth of their depression. Most people still have this resilient will to live in that moment. But it's when they're in that chemical mix of withdrawal. There's something about that seems to pull the rug out from underneath people's brains, and that's when they start to have suicidal thoughts and behaviors. So this is an important thing for us to be more aware of culturally, for us to be talking about, for us to be cognizant of, both as people who are taking medications or deciding whether or not to go on and off medication, and also for people around people on medications going on and off medication, because you really want to be in a particularly supportive role when someone is in one of these vulnerable moments. You want to make sure they recognize that they're in a form of a false mood, that this is withdrawal. And when they're having these hopeless, despairing thoughts, that's the withdrawal talking. It's not really them. So if you're going through something like that, keep yourself safe. Get all of the help you need. Call 911, go to the emergency room, call your psychiatrist. Bring a support network around you at all times to help keep you safe until you get to the other side of that false mood. And if you're somebody around someone in those kinds of vulnerable moments, be a midwife to them. Help them understand that they're going through an incredibly difficult withdrawal process and that these thoughts are part of that process, but that you're there to support them and keep them safe until they get to the other side of it. So I hope that's helpful, and we'll talk more about that. I know it's controversial, but I want to make sure that that's at least out there in the discussion. We'll see you next time on Rebel Health.